Professor Tim Spector is an epidemiologist. His company Zoe has been behind the COVID symptoms app developed by King's College London, which collates its own data from millions of people self-reporting their symptoms every day, allowing Professor Spector's team to follow a pretty up-to-date picture of the infection around the country. Professor, welcome to Spectator TV. I know it's a busy time of the year, so we're grateful to get your time. Tell us a bit more about the work that is done at Zoe with the COVID symptoms app.
We launched on the 24th of March, the first day of lockdown, and we were about the only game in town, the only app that was out there that was able to gather data on people, and within 24 hours we had 1 million downloads and now have 4 million subscribers, of which about 1 million are giving us near daily reports. And this, combined with getting people, when they get symptoms, tested rapidly, allows us to get a running in real time estimates of what's going on around the country in a way that the other systems don't. We do track the ONS study, the government's official survey that goes into households. So we get very similar estimates, but we're normally about 4 or 5 days ahead of them.
So, tell me, what divergences do you see, if there are divergences, between the data you are garnering and the official government data that we tend to look at either on the daily cases and deaths cases or in the ONS figures and so on? What are the differences?
Well, very few differences with the ONS data, but we do see differences with the confirmed cases. So the problem with the confirmed cases is that total goes up and down somewhat erratically because there's no denominator. There's no fixed number of tests they do, and they look at the percentages, because once an outbreak starts, then more people get tested, people get nervous, and they find more cases. So I think at the moment, using just these confirmed cases, which is nice for media headlines and as like deaths, doesn't give the full picture and often exaggerates rapid changes going up or down. And so I think our data on the ONS is a better guide to actually what's happening and doesn't show as bleak a picture as often is portrayed with the deaths and the confirmed cases. So, you know, the ideas of these massive surges in London aren't borne out by our data. We are seeing increases, which are worrying, but we're not seeing increases in the over 60s. We're recording hospital admissions because we were told by the government that these 5 parameters to assess tiers would be transparent and given out to everybody, but that hasn't materialized. So we're on the app providing that to users, and anyone who logs into our app gets the full report. So we're trying to be more transparent, so we believe people will act responsibly if they're given the data. And at the moment, they're not being given the data, they're just being given a bit of a stick. And so that's generally what we're up against. And looking at our data over the last few months, we are able to look at certain patterns and realize that, you know, certain decisions about lockdowns, etc., or Welsh fire breaks, you know, have actually failed or were taken prematurely, as Katie mentioned earlier, that sometimes these big decisions are taken too early without the latest data, and by the time they find out, everything's changed, and then, you know, the data are retrofitted to go with that decision. So I think you need to look at all the data and also get the most up-to-date data, I think, is really important, because there are huge differences across the country. And we talk about it as if there's only one, you know, these massive regions, or the UK is one thing, but we're predicting by Christmas there'll be 10-fold differences across the country in how likely your local bubble is to have COVID. And, you know, and that should make, and having one rule for everybody when there's a 10 times different rate of infection, to me, doesn't make much sense. And we do need perhaps a more local, regional way of doing this, although I understand it's difficult politically.
That's fascinating. Let me ask you a question about what your data can tell us about the second wave, but also a question about now. I'll begin with the second wave. What does I mean, if we look at the government data and we listen to the politicians and the scientific advisors around them, I think a lot of us have been quite surprised by the scale of the second wave and by the virulence and by the longevity of it. But we're surprised from a position of no expertise. What does your data tell us about how do you see the second wave through your data?
We're seeing that if we take the UK as a whole, we're seeing it so far is less causing less problems than the first wave. It's affecting young people more than old people. It's causing less hospitalizations. We're not seeing, with a few exceptions of a few trusts, we're not seeing most hospitals being overrun. And we're seeing big differences between areas that we didn't see as much in the first wave, possibly because of areas that were hit very badly in the first wave, like central London, not having as much problem in the second wave because of some relative immunity. So it's a different picture, but as we've seen, the thing here is we're seeing that as these restrictions have been relaxed, strengthened and relaxed very quickly, which we didn't happen in the first wave, we're seeing these major rebounds like we're seeing in Wales, where it looks like post-fire break, things are twice as bad as they were before. And we think this is related to people's behaviour who, knowing that we have this extraordinary position in this country where we announce some new tier system coming in, and all the pubs will shut in 3 days' time, and get surprised that people go out and meet their mates in the next few days. And then we lock them down for again. And we see these very much behavioural effects that I don't think have been taken into account. So looking at the data, we'd say it's a big mistake to keep turning these screws up and down. And looking at the first bit of the second wave, it looks like the decision to have a national lockdown wasn't really justified anyway, because it was coming down in the north already before that at quite a fast rate. So I think, it's easy with retrospect to look at this, and I think it's a really tricky problem for government. But I think we do have the data to enable us to learn lessons going forward. And I think it would be not to keep turning the tap on and off, it would be to actually have some regulations until Easter that make sense and give people this local information about what's going on in their hospital, what the rates are, what their real risk is. And I think that's where we're hoping to do that with the Zoe app.
It would seem what you're saying, Professor, is that the government needs better data, more reliable data on which to base its decisions. And once it's based decisions on that more reliable data you're talking about, there should be an element of consistency in whatever lockdown or restrictions there's going to be, that we should abandon this, what we've called here on Spectator TV, the sort of hokey-cokey of in and out, shake it all about. Would that be a fair summary of what you're saying?
Yeah, absolutely. And I think we have to also set, we have to set some idea of what what's the aim? What is the outcome here? Is it just to stop levels, as the media calls it, surging, and everyone gets in a panic? Or is it actually to say, help, stop the NHS from being overrun where it can no longer cope? And at the moment, that is based on, a couple of parameters: numbers of people over 60 with the disease and the percentage of people in hospital with COVID. And at the moment, they're at manageable levels. And we need to keep but we need better data on that, which isn't being provided at more local level. I can only get the regional level at the moment. And I think that would tell people how to behave long term without these big behavioural fluctuations, and people would be able to plan things. And I think that's the big difference. And also realising that national lockdowns, effectively someone's worked out that cost the same as the whole NHS budget for a month. So you could have doubled the year's budget in the NHS, increased capacity, and someone needs to start thinking about the bigger picture here, about the pros and cons of doing this stuff rather than knee-jerk reactions because, suddenly deaths go up in one region, overnight. And I think that's what's needed, a longer-term view, using all the data and perhaps getting, people from different disciplines, economists and other behavioural scientists, more involved in some of these decisions.
Well, let me bring you right up to date then. Health Secretary Matt Hancock said this week that in some parts of England, there's a doubling of infections every 7 days. And he used that stat to justify moving London and the southeast of England into tier 3. Does the data justify that, Professor?
Our data doesn't, no. But if you take London, overall it's doubling every month, our last count. But there are some regions, the northeast, where it is doubling every week or 10 days. But you can always post hoc find data to support a decision. And I think that's generally what's happening here. And the question is, do you lock down, the decision was made to lock down 9 million people when in fact there are these particular hotspot areas that are very alarming, but that, there's a 6-fold difference even in London between the rates of new infections. So it is complicated, and I think people need to find out what the local data is in their area. And if you can stop people moving between areas, that should be doable. So I do think we need a longer term approach to this that isn't locking everything down, crippling the economy for areas that have very low levels of infection. And I think, that's the big message here this Christmas. In a way, you do want different rules for different areas. And I think, it may sound unfair, but that's the scientific argument.
Professor, on the basis of the data you're gathering and then looking forward into January and February, there are fears that I've referred to that the Christmas easing up will lead to a spike or a resurgence in cases. And then there is also talk of a third wave. I think you have some views on that yourself. What does January, February look like to you?
Well, I'm not as worried about seasonal flu as James was. All the data show that we're at 10% of the normal rates of respiratory infections. So it just shows you that we can prevent the normal colds and flus. I haven't had a cold all year. For a year, it's fantastic.
And that's because we're not mixing. We're not mixing because of COVID.
Exactly.
It's reducing the flu infection.
So we're not going to get a massive influx of flu that was feared. And most people thought we would, but they haven't factored in our amazing behavioural changes. So I think it's going to be really all about COVID. And this will come in, I think we will get rid of this second wave. And I think there will be a lull. And we will see another one probably in February. But I believe it's going to be less than the first two. A quarter of all the infections are now coming from hospitals and care homes. So if those staff are taken out of the equation, then we won't be getting the deaths or anything else. So I think things are going to look up. The infection's still going to be around, but deaths and the severe consequences will get better. So I've got a slightly more optimistic message for Christmas if we all behave.